Retract lip to visually examine the labial mucosa. Use thumb and index finger to retract lip to reveal labial mucosa. Digitally palpate the labial mucosa. Retract the cheek to visually examine the buccal mucosa. Use the finger or mirror to reveal entire buccal mucosa. And then palpate the buccal mucosa. Visually examine the alveolar mucosa. Retract the cheeks, tongue, and lips using index finger or mirror to reveal the alveolar mucosa. And digitally inspect the alveolar mucosa. You're looking for any gingival evidence or exudate. Visually inspect the hard palate. Use the mirror for indirect illumination and vision. Digitally examine the hard palate. Visually inspect the soft palate. Use the mirror for indirect illumination. Visually inspect the floor of the mouth. Use the mirror to retract the tongue to reveal the floor of the mouth. Manually palpate the floor of the mouth. Use your index finger, opposite hand to gently compress the floor of the mouth. Compress with one finger intraorally and support the tissue gently with the other hand. Visually inspect the ventral surface of the tongue. Request the patient to raise tongue to the roof of the mouth to reveal the ventral surface.
Please put your tongue to the roof of your mouth.
Visually inspect the dorsal surface of your tongue. Request the patient to extend tongue forward to reveal the dorsal surface.
You say ah. Ah.
Press the tip of the tongue with a 2x2 gauze to reveal posterior tongue.
Stick your tongue out for me. Say ah again. Ah.
Palpate and visually inspect the lateral border of the tongue. Use index finger thumb to feel for any anomalies. And inspect the posterior 1/3 of the tongue. Visually inspect oral pharynx and tonsil area. Using mirror to gently depress the dorsum of the tongue. Reveal oral pharyngeal area. Ask the patient to say ah if necessary.
Again. Perfect.
Visually inspect the patient's occlusion, overbite, overjet, and posterior occlusion.
Turn to the right for me.
Enter all information for your Intra-Extra oral online.